What is the O-1 visa for medical professionals? It's a special class for those with extraordinary ability. Crucially, the O-1 visa can bypass the J-1 visa's 2-year home residency requirement. Unlike the H-1B, there is no annual cap and no lottery. If you qualify, you can be approved. And this is not a short-term solution. The O-1 visa can be extended indefinitely. We will break down extraordinary ability, the proof you need, and the application process, step by step. First, the standard. Extraordinary ability means you are in the small percentage at the very top of your medical specialty. There are 2 distinct ways to prove this. The first is clear-cut, winning a major, internationally recognized award, like a Nobel Prize. For almost everyone else, the path is providing evidence that satisfies at least 3 of 8 specific criteria. This 3 of 8 list is the foundation of your petition. In a moment, you'll learn exactly what they are and the proof they demand. But before that, understand this. You cannot petition for yourself. You must have a U.S. employer or a U.S. agent file for you. You have the standard and know who files. So, how do you construct the case? Let's get into the specific evidence required. Let's close that loop from earlier. Here are some of the key criteria you can meet. We'll cover 4 common ones quickly. 1. Nationally or internationally recognized awards for excellence. 2. Membership in groups that demand outstanding achievement. 3. Published scholarly articles in professional journals. 4. Proof that you have judged the work of others, like peer review. 5. Performing in a critical capacity for a distinguished organization. 6. Commanding a high salary relative to others in your field. The most significant criterion is making original scientific contributions of major importance. This can be a new surgical technique or clinical protocol. The challenge is proving major significance. This is done through letters from other top experts attesting to your work's impact and adoption. A frequent misconception is this visa is only for researchers. That is incorrect. The O-1 is attainable for pure clinicians too. For a clinician, an original contribution could be documented skill in a rare, complex procedure or being the regional expert for specific tech. The proof might be different. Testimonials on your surgical outcomes or records of you training other doctors. This is comparable evidence. Assembling this portfolio is the most time-consuming part. This is not a last-minute task. It often requires 3 to 12 months. So you've built your case. What are the formal steps? And what are immigration officers scrutinizing today? Lately, USCIS has increased its focus on the nexus between your past work and your future job. You must show the position demands your abilities. They also now look for evidence of broad influence, such as authoring clinical guidelines or innovating care pathways that improve outcomes. A mandatory part of the formal petition is a written advisory opinion. This letter from a U.S. peer group validates your claims of ability. Standard processing can take many months. However, you can pay a fee for premium processing, which guarantees a response in 15 business days. Common errors include relying on local awards, submitting vague proof, or failing to explain your work's importance to a non-specialist reviewer. Let's connect all these points. Why is the O-1 such a potent instrument? It is about building a stable, long-term career path in the U.S. Recall the indefinite extensions? Combine that with dual intent. This means you can hold O-1 status while pursuing a green card. Consider the full picture. You can bypass the J-1 rule, avoid the H-1B lottery, and have a clear path to a green card. This combination is unique. The O-1 is more than a visa. It's a proactive strategy. Documenting your work builds a definitive record of your career's professional impact. To recap, the O-1 visa is for medical professionals who can prove they are at the apex of their specialty, be it clinical practice or research. Success depends on framing your achievements through the specific lens of the 3 of 8 criteria, translating medical skill into a legal argument. While the standard is high, it is achievable. For petitions that are well documented, approval rates can exceed 90%. If you believe you are at the top of your field, the time to begin documenting your extraordinary ability is now. Your future could depend on it.